So today I'm going to show you a release for your psoas, which is part of your hip flexors, and it's one of the longest muscles in the body, and it's a weird one because it crosses two joints. So usually muscles are just responsible for moving across one joint. But this one starts at your ribs, comes over your hips and then attaches to the leg. And it's thought to be sort of connected to fear response and trauma and stuff like that, so it tightens up. So it's good to release it for that reason. The posture that we take on in pregnancy will have an effect on the psoas as well. So it's good for releasing the back as well. You might find that your back feels not so arched if you do this position. The psoas, because it runs over the hips, it's like a little tram line, and the uterus sits inside it, so it's almost like it's the internal support for baby, and helps with direction of outwards. So if you're tight on one side to the other, it might have an effect on positioning of baby, it might have an effect on how you labour, and it's just quite nice as a relaxation. So this is one that I can't do in class usually because it involves needing to be bolstered up, and also the longer you take over this the better. So what you need is something to lie on so that you're slightly propped up. I'm using a yoga bolster, so if you've got that then you can use that. Otherwise you could use a couple of sofa cushions or some folded towels. So 2 or 3 folded bath towels would probably be enough height, and shouldn't give too much. You might also then need something to prop your head up as well. So because your ribs are coming onto the bolster, your head is going to be elevated, so it might want to drop back, and you want to keep it supported so the neck is in alignment. So all you're going to do is come down onto your back. So from a sideline position, you want to aim your rib cage onto the bolster, so it should be just about above your bra strap level. And I'm sorry if you don't see me 100% here, but I had to come this far back so I can stretch my legs out. So as I say, look, this is how far my head wants to be up. But if I come back here, it's a little bit too open through the throat. It feels like I'm falling back a little bit too much. So again, I'm going to put a little bit of support there so everything feels more in alignment. So the bottom of the bolster is just above my bra strap, so the whole of my shoulder blades are being supported, my head is supported, and then I'm going to lengthen my legs right out. So normally this position for me would really hurt my back if I was lying flat with my legs out, because I tend to go into an arch. But the whole point of this bolstering up is it helps your rib cage just to let go of tension. So you should get a sense of your ribs sort of sinking down towards the floor. So the longer you hold this position, the more you should feel that just kind of sink. It's not that you're pressing down or trying to force your rib cage down onto the floor. So you just want to allow that relaxation to happen. And then your arms can just come out to the side. Because we're going to hold this and release into it, if you can, it'd be nice to have your palms up to the ceiling so that your chest is also getting a little bit of opening here as well. So by having those palms rotated, it allows the chest to open. You've got your chin nodded, neck is long, so that neck is releasing. Again, you're releasing through the ribs, through these hip flexors, and all you're just going to do is just lie here. So if you're further on, you might not find it as comfortable if the weight of baby is pushing down a little bit. But if you can hang here for a bit, that's great. Feet, doesn't matter. It doesn't matter if they drop in or drop out too much. Ideally, keep them in parallel. My feet are touching the wall here, so it's hard for me to relax them fully down. But you can then just lie and focus on your breathing. So it's a good opportunity to take time on your breathing, focusing on the in-breath and the out-breath. And just feeling that on your out-breath, you just soften. So same as we do in the relaxation, not doing, just letting. So nice deep breaths in through the nose out through the mouth or through the nose. And each breath out, you just want to allow your body to let go. Feel it softening down towards the floor. And then you just spend as long as you like in this position. And just let that release happen. And hopefully by the time you've finished, you should feel that your back has softened through. I can already feel mine is lower down to the floor than it normally would be. So then when you're ready to come out of the position, just bring the knees in so they're bent and your feet are flat on the floor. You can rock through the hips a little bit if you need to reawaken them, or just hold that position just for a few seconds, and then from there rolling over onto your side again, ready to come back up. So it's a really nice position to be in, really good for back pain, it's really good for relaxation, and actually letting your psoas release before bedtime is quite a good way to get a good night's sleep as well. So that's one way to release the psoas. Hope you enjoy it, and I will see you next time.